So as you heard, you're going to hear a student panel today, and it's a panel of students from a program that's called the Appalachian Career Training Oncology Program. I'll tell you more about what that program is all about in a bit. But before the students come up, I wanted to give you a little bit of perspective about why this is important, why we're here, and what the program's all about. So that's what I'm going to do briefly, and then students are going to come up and they each have a slide that they're going to talk just briefly about to introduce themselves. And then we really want this to be a discussion and questions. So be thinking of questions that you can ask, mostly the students, because they're very excited to answer questions, as you can imagine. So why is this important? So Kentucky, as probably all of you are aware, has a massive cancer problem. We rank first in the nation in overall cancer incidence, second in cancer mortality. So arguably, no other state in the nation has a cancer problem quite like ours. Over 30,000 new cases in the state each year, over 10,000 deaths. And what's worse is that the cancer problem is significantly greater in the 54 counties that are in the Appalachian region of Kentucky. One anecdote here on this slide is that Appalachian Kentucky residents are 8% more likely to die from a preventable or screenable cancer than their non-Appalachian Kentucky counterparts. Lung cancer death rates, colon cancer incidence and death rates are just astronomically high in eastern Kentucky, as are other cancers as well. So if you're not familiar with the area, Appalachia spans a 13-state region in the eastern part of the U.S., 420 counties. All the counties you see here on this map that are shaded are in the Appalachian region. Kentucky, the Appalachian region in Kentucky is in central Appalachia. Again, there's 54 counties. I've already told you that there's very high cancer rates. Just very briefly, the reason for that is many things. There's not just one thing, there's many issues. There's very high smoking rates, high obesity rates, chronic infection, high poverty, very high persistent poverty, low healthcare access, low healthcare engagement, low education levels. So all these things work to create the perfect storm for why the cancer rates are so great there. So because of these reasons, back in 2016, I created the Appalachian Career Training and Oncology Program to help us address this issue long term. The idea is that we recruit high school students, undergraduate students from the area, get them involved in this program, and help or work toward motivating and preparing them to hopefully pursue cancer-related careers so that they can help us tackle the problem. They're from the region. Who better to help us address the problem, especially long term, than people from the region? So in the program, students come in, they get research experiences on campus, they learn a lot about cancer in the classroom, they do a lot of career development type activities, they get clinical shadowing opportunities, and then there's outreach. So students do outreach on their own, and then the program itself works to do a lot of outreach also. And I've already told you the bottom part of that slide is the overall mission. We want to create the future cancer professionals in the region who can help us address the cancer problem. So again, I've been doing this since 2016. We've had over 150 students now from 40 of the 54 counties in Appalachia. The goal is to get students from every county. Some counties are harder to recruit students from than others, but you can see sort of where those counties are on the map. The number of undergrads and high school students is almost split 50-50. So of our undergraduates that have graduated undergrad now, 44 of them have gone on to medical school. 15 have already graduated medical school. They're all in residency programs. 4 have matriculated into pharmacy school. 2 have graduated. 4 have gone on to a physician assistant program. 3 of those have graduated. 1's graduated with a PhD in cancer biology. Of our high school students that have graduated high school, all of them have graduated high school that have been eligible to do so. 44 of them have gone on to college, so all of these education statistics far exceed the expected educational attainment levels that you would expect from people in Eastern Kentucky. Our students have published 25 peer-reviewed manuscripts. So these are manuscripts that have been published in cancer research journals where students have contributed to the level that they're authors on these papers, which is phenomenal. I didn't publish a paper until I was like a third-year grad student. So having students do this as undergraduates is great. We've published 3 books. We have a 4th book that's going to be out in about a month. These books are composed of stories that students have written about their own experiences with cancer in the area. The first 2 books was stories about real life personal experiences. The other 2 books, we had them do something different, which was we had them write realistic fictional stories about cancer in Eastern Kentucky. And these books are a way for them to learn more about their own personal histories with cancer, their family, their communities, history with cancer. But also then it becomes an opportunity to engage readers, community members about the problem in Eastern Kentucky. We've done a photo voice project. Don't really want to get into what that is, but love to talk about it if anybody else wants to talk. And we've done a short video project where we profiled a few people who have had cancer in Eastern Kentucky, put that out on the internet as, again, a way to engage the community around the conversation about how cancer really impacts people in the area. So that's a highlight of the cancer problem, what this program is and what we do and some of the outcomes that we've had. So now you're going to hear from a couple students, and they'll just come up one at a time. They're going to tell you a little bit about themselves. We'll go through all the students, and then we'll have some questions or discussions. So again, be thinking about what you want to ask, particularly as students. Megan?
Hi everyone, my name is Megan Sexton. I'm from East Carter County, and I'm a rising senior. With the help of Action, I've gotten to work in a research lab over the summer, and I worked in the Gibson lab. This lab looks into substance use disorders and how self-administration or withdrawal changes in neurobiological outcomes in a rat. This has taught me basic animal handling skills and lab skills, as well as how to treat any subject, human or animal, with proper decency. And that same sense of decency should extend to the way we care for our communities as well. Living in Appalachia, I'm seeing struggles with health that aren't the same for the rest of America. Within my community, when there is a cancer diagnosis, families often rely on churches, local nonprofits, or other networks for emotional and financial help. This system creates a powerful sense of unity, especially when cancer touches those close to us. I experienced this firsthand when I joined my cheer team. My coach was battling breast cancer. We partnered up with the counties around us to save enough money to help her with her treatment. This taught me how to work as a team and have confidence in myself. She's one of the main reasons I joined Action. Another diagnosis that really affected me was when my grandpa was diagnosed with stage 4 colorectal cancer. With education and preventative screenings, the cancer could have been caught much earlier, so it wouldn't be as dangerous. Many people in my community view screenings like colonoscopies or prostate exams as invasive or uncomfortable, but they might not know annual screenings promote cancer detection and early treatment. With the help of Action, I've gotten to work in a research lab I love and meet amazing people who care about bettering Kentucky. I've gained valuable knowledge on vaccines, screenings, and risk preventative behaviors I can take back and instill into my community. Thank you.
Megan, if you want to just sit here and we'll do the Q&A. All right, Cambria.
Hi, my name is Cambria Bowen, and I will be an upcoming junior at Estill County High School. I got involved with Action through another program where we watched a presentation that Holly and Dr. Vanderford did at UK. This program has been life-changing and given not only me, but so many others amazing opportunities. Personally, I was able to shadow in the Dance Blue Clinic, which focuses on pediatric hematology and oncology, as well as shadow a surgeon in the OR. Cancer is very personal to me due to a loss in my family. My sweet Mimi was diagnosed with a glioblastoma in 2022 and passed away from it in December 2023. The specific cancer she had currently has no cure, like many other cancers. She was my everything, and experiencing a loss like that was heartbreaking. However, it led me to where I am today. Action has provided me with the resources and opportunities to learn more about cancer and healthcare in general. Through this, I and so many others can help people in Appalachia and all over the world. And this photo up here is a stocking that my Mimi's friend made me, and this was part of our Photo Voice project, and yeah.
Haley?
Hi, I'm Haley Workman, and I'm an upcoming junior at Menifee County High School. I first learned about Action at the end of my freshman year when Holly visited our school. As she shared more about the program, I immediately knew I wanted to be involved. I've been interested in healthcare since I was in elementary school, but my passion solidified in 7th grade when my dad was diagnosed with skin cancer, which later progressed into small lung cell cancer. I spent much of the next 3 years in hospital waiting rooms where I saw the fear and uncertainty experienced by patients and their families, which I deeply understood. That experience motivated me to pursue a career in cancer where I could support families facing similar challenges. When my dad went into remission at the start of my sophomore year, the relief I felt only strengthened my desire to make a difference and bring that hope to others. The Action program has given me a path toward that goal. Since joining, I've gained hands-on experience and exposure to a wide range of fields, including observing an operating room, participating in behavioral and research labs, studying fruit flies and enclosed labs, and holding a human brain and spinal cord. I've also attended meetings with my PI, participated in Dance Blue and PAC, and explored the fields of social work and oncology. Most importantly, Action has given me the knowledge and platform to raise awareness about cancer and oncology in my own community.
All right, last but not least, Cameron.
I've got a little bit of age on the other students up here. I'm an incoming junior at the University of Kentucky, and I went to Greene County High School. And honestly, I've had a lot of familiarity with cancer over the years and cancer in my community, and I included that picture at the bottom because Twisted Pink is pretty close to my heart because the former volleyball coach at Greene County High School, her name was Lynn Gibbons, and she was an amazing woman, and she unfortunately lost her battle to metastatic breast cancer when I was in 7th grade. And so cancer was kind of just always one of those things that I was just aware of it existing in my community, and it kind of just became normalized as you receive this diagnosis and you kind of just go through the motions, you receive the support of your community, and that's kind of all there is to it. But for the majority of the time, it is sort of a death sentence. And when I was entering undergrad at the University of Kentucky, I had a friend who I also played volleyball with, so we kind of witnessed the same issues with cancer, and she told me about Action. And when I realized that there was actually something that I could do as a just a scared little college girl from Greensburg, Kentucky, it really just made me feel so empowered that I can contribute to the cancer crisis in my state. And so this photo here is also from our Photo Voice project, and it's a barn that's out in Greene County, and it has Lynn Gibbons' initials, and the caption is up there, but it reads, "Cancer creates heartache, fear, anxiety, and distress. However, in an Appalachian community, astounding unity and support are also present. Lynn Gibbons was a pillar of the community of Greensburg, Kentucky. The weight of her diagnosis and fight with metastatic breast cancer was taken on by all who surrounded her, which is why the barn shown is proudly branded with her initials and stands as a reminder to all of her legacy. It is a testament to the love and devotion of the community as her memory is continuously held in the hearts of all who knew her." So kind of action has been everything for me. It's given me shadowing opportunities, research opportunities, and honestly just a voice to speak about cancer and to continue to contribute to the fight against it. So, yeah.
All right, so now, Cameron, don't go far. So y'all can come up, and we'll start questions, discussion. Do the mics, do these work? They do. Okay, so y'all can. They should. Yeah. So
I'll take one for questions.
I'm going to start with a question. They've been trying to figure out what questions we're going to ask. So I'm going to start with a question, and then I'd really love for y'all to ask questions, have a discussion. So the first question I'm going to ask is, so y'all in this program have learned about the big cancer problem in Kentucky, right? So first in the nation in overall incidence, second mortality. So did y'all know that before coming into this program? Do you think your community members, your family members know that? And what does that mean if you do or if you don't?
It's a great question. I will say personally, as I kind of mentioned before, you know, the cancer disparities in our region are kind of just something that has become normalized around us. It's not necessarily that we don't know about it, it's just that we're sort of desensitized to it all. And, you know, you just kind of get used to hearing someone else that you know has received a life-changing diagnosis, and you're not really understanding that that's not a problem everywhere else. And it's, you don't really understand that it's just affecting your area because that's really all you're exposed to. So I'd say that kind of my experience with action has made me understand that this is not normal, and that there is action that can be taken, and that we can do something about it. And so I think what action has taught me has made me kind of spread awareness to the people in my community.
So I definitely thought cancer was like common in like every state, like how it is in Kentucky. Like I thought everyone's grandparents like eventually get cancer, or like your neighbors have cancer, and I thought that was like pretty normalized, but it's really not. And with the help of action, I'm hoping I can take that back to my community and make sure everyone else knows that's not normal.
I guess I didn't really know how common it was in Kentucky. I mean, I've heard people getting it and stuff, but you never really know until it happens to you. And when it happened to me, it really made me want to look into it more. And then I found that through action, that the cancer rates in Kentucky are not normal, and we need to do something to change them.
Personally, I never really talked about it in my community. It's something that a lot of people kind of try to avoid in fear of upsetting somebody. And so it's just something that we didn't really discuss a lot. And so I kind of hope to start talking about it and let people see it's not something to fear, but to fix, I guess.
Yeah, to address before it becomes a problem. Yeah, that's my experience going out into Eastern Kentucky in particular, talking to people. They know friends, neighbors, family members that have cancer, that have had cancer, but they don't realize what a massive issue it is. I mean, they just see it in their community, and then when you tell them, they're like, oh yeah, well that makes sense because so many people that I know have cancer. So I think knowing it is half the battle, right? Because once we know it, we can start working on trying to address the problem. So, what questions do you all have?
Hi, thanks so much for your presentations. I definitely enjoyed those. I think one of you mentioned education around risk prevention behaviors and the importance of that and how you're doing that through action. So I was just wondering if you had some thoughts, especially around your experiences in the community, on helping to motivate those mindset shifts and transforming so that people would actually do those risk preventative behaviors. What are some things that are working, or what are some suggestions you may have on that?
Yeah, absolutely. I would say kind of like the common theme with that, because that is a big problem with, how do we motivate these people to go to the doctor and to, take these preventative measures. And I would say that the biggest thing that action has taught me is that the reason that it's so vital to get to kids from our area is so that we can become practitioners that they know and they trust, because trust is a big issue with the people of Appalachia and the way that they approach healthcare. And so I think honestly the best, I guess, method of going about this is taking people from the community and making them practitioners in that area, and, you know, kind of creating that trust in that, you know, they see my face, they know me, and they think that I'm not going to have them do something that is not worthwhile, or it's not worth the time or the money, or, you know, just things are along that line. I'd say that that's probably the most effective method. But
I agree. So if y'all were here last year, you heard me tell some of my stories. So I'm from a rural Appalachian community in Tennessee. Shares most of the same similarities as Eastern Kentucky. Both of my parents have had cancer. My dad died of lung cancer in 2010. My mom has had breast cancer twice now, and she's survived both times, and she's okay today. But I agree. I mean, I think so many people try to avoid the issue in rural areas. So I think the more that we talk about the issues, talk about cancer, talk about what causes cancer, talk about ways that you can be screened to help, you know, early detect or prevent completely, I think that's going to be huge. But one of the biggest issues is that people just don't talk about it. I think that in some ways, maybe they fear that they're going to manifest this issue in themselves if they talk about it, or it's just, you know, they don't want to think about death or all those things. But as we know, you got to talk about these issues and face them to be able to prevent and or detect early so that you can have a better chance to survive.
absolutely. And Haley kind of touched on that earlier. Cancer is just kind of like a hush-hush topic, because, you know, you don't want to like speak it into existence, or just, you don't want to hurt someone's feelings or bring something up that's uncomfortable. But I think once you overcome that kind of hump and you get to that point where you are comfortable talking about it, that creates a world of opportunities. So.
Oh, sure. So great job, everyone. I thought everyone was very well spoken. Everyone's professional looking, and, you know, in the presentations here, you can see the energy, the compassion, and it's nice to see that in someone, you know, younger along their career and training. And, you know, I remember when I used to kind of be that way many years ago before medical school beat that out of me. No, it's not that bad. So, you know, it sounds like you guys are very familiar with, you know, UK, and, you know, you're at U of L today. Do you guys have any specific things that you wish the universities would do more to do outreach or to do, you know, education? Because, you know, I'll tell you from our end, you know, I'm obviously an oncologist here at U of L. You know, part of what we do, and I'm sure Markey as well, is we're trying to supply the oncologists for Kentucky going forward, right? I've been here for 15 years now. I did medical school, residency, fellowship, and then now, you know, I work here. So, you know, the process works sometimes, but there's certainly more that we can do. So I'm curious, kind of on your all's perspective, you know, what do you think the universities should do more of?
Well, honestly, I'm very proud of I mean, UK pride, I guess, but like I'm very proud of the University of Kentucky, and I feel like we've taken, with Dr. Vanderford and Holly, our other program coordinator, I feel like they've taken a lot of really effective steps to continue engaging people of our age, because, I mean, they're all in high school, and I can't even imagine when I was in high school coming to a big school and doing cancer research. Like, I think that the steps that are being taken by Markey and UK at the moment are very effective, because, you know, it creates a domino effect of, I'm from Greene County, and I can tell people in high school now about this program, and they can continue talking to their friends about it. And so, honestly, I feel like just the creation of these programs that are getting to people who wouldn't normally be hearing, like, of all of these opportunities and all of the steps that they can take to get involved and do these things, I feel like that's kind of the most effective way, because, I mean, the best advocates for these programs are these students. Because, I mean, I could go and talk to kids at their high school all day and tell them, you should do this, but they're probably not going to trust me as much as they would trust one of them. But yeah, do you guys have anything to add? Oh, yeah. Yeah.
Well, I'll say something again about that. So I agree. I mean, I think the more that we get into communities and integrate with the people there, the more connections we make, the more trust we build, the better. I can, again, from my own personal experience, so I'm from rural southern Tennessee, 2 hours away from Nashville, which is the primary place that people need to go to get good care in Tennessee. And Vanderbilt does outreach clinics into my county and other rural areas. And it builds huge bridges, right? When patients don't have to go 2 hours away to the big city, they can just go up to 20 minutes drive into town and see a Vanderbilt provider. And what's best is then if that provider has some connection to Middle Tennessee, which fortunately my mom had that case. She had a doctor who was from her county, and it was like they would go and talk about all these things. And that's what I hope we do with this program. That we create future physicians who are from these counties who can go into the counties and practice in some way, even if it's just outreach clinics or whatever. Building those connections with the community, I think, is critical. And I think the universities over the last, 5 to 8 years maybe have done a much better job focusing on training students from Kentucky and really working on keeping them in Kentucky. And I think the more that we do that, the more successful we are, the better we're going to have at cancer and many other health issues in the state.
So I wanted to say thank you first. You guys are awesome. I was most excited to see you all here today and hear about this program because it's just so invigorating. I have a question. You guys always speak to the positivity of the program, and this is not like a go to the other side, but I'm very curious about what have been the complicated conversations that you guys have. I can only imagine that kind of bringing this to perhaps your grandparents or others in your community that are pretty set, in certain beliefs. What have been some of the challenges that you have faced, and how do you all support each other through that to keep kind of trudging forward?
Do any of you all want to start? I feel like I've been hogging the mic a little bit. Okay. All right. Well, I feel like it kind of is like you kind of already said it a little bit. I feel like a lot of the members of our communities are pretty set in their ways. And so it's pretty difficult for me to go to my grandparents who have always eaten a certain way or always, consumed certain tobacco products or something along those lines and kind of tell them, these are probably steps that you should take to better your health. You can be proactive to take these steps and to do these things. But I feel like that's the most difficult part because they're you so often hear the phrase, well, I've always done this and it hasn't killed me yet, or something along those lines. And I feel like that's probably the most difficult part, seeing these people that you love and that you really, truly care about, and that you're giving them valuable information that can better their health and kind of prolong their lives so you can keep them in your life and you can continue to be around them. But, it's so hard to change the mind of someone who has always lived a certain way. And I would say that that's probably the most, and you guys probably agree, that's probably the most difficult part about what we do, because we know that we are focusing on the youth and there's a lot of hope for the future, but there are so many people that we love and so deeply care about that are a part of older generations. And I wish that it was a little bit easier to have them understand why we care so much and how we are so confident in these things that we know because we've just dedicated so much time and effort to it. But I would say that's probably the most difficult thing. And yeah, do you guys have anything?
So I think it's really difficult to talk to older people, but it's also really difficult to get across to our peers because of our age, and they don't take us seriously until they hear the statistics we learn with action. And most of them don't even know how serious cancer mortality in Kentucky is.
Adding on to that, I think it's also very difficult with our peers because, they see the statistics and they see the people that are getting cancer, but they just brush it off. They don't care. They think, oh, well, I'm young, I can live, I'll have a good life, but that's not always guaranteed, especially with the trends and habits that we're seeing in the youth today.
I'll add, this is very difficult to do, to have very difficult conversations with family members, community members. My sister smokes, she saw our dad get lung cancer and die literally almost in her arms. And so but it's still very hard to have these conversations with her, and she knows, right? So I don't know, it's just so difficult to have critical conversations with the people that you love, because I think in one regard, they're the people that might push back the hardest, right? Because they're comfortable with you, they're gonna just tell you to stay out of their business or whatever. So it takes a lot of courage to have conversations like that with people that you know, or peers that, you know, might make fun of you or whatever. So that's an area that we can probably all grow more in, about, you know, learning how to have those conversations, but it's hard. Yeah.
I have a question. Kudos to you guys. I'm so proud of you all. You're so young and you can make impact, and you are making impact. But what can we do as adults in other areas, Louisville, Lexington, to help you all to make more impact with your peers? Is it doing more health fairs, industry investing more resources for you all to really show them that small steps can make impacts? And, you know, Eastern Kentucky is such a family-oriented, close-knit community, and, you know, outsiders, as you pointed out, you know, don't resonate, right? So how can we help you all, you know, convince your peers? Because I think that's where, you know, the younger generation is going to change the outcomes in the future. It might be hard, stubborn. We're old. When you're old, you're stubborn, right? You're set in your ways, and it's inevitable you're going to die, right? We all have expiration dates, and we all have habits that maybe, you know, they're going to rush that expiration date sooner. So what can we do to help you all? What resources do you all need additionally?
I would say, as simple and as silly as it sounds, I think the most valuable thing is just kind of being our biggest advocates and being like joining in on our advocacy efforts, but also just telling others, you know, these kids are passionate about what they're doing, and you should trust them because they dedicate their time and their education to this cancer crisis. And I think that there's so much value in just speaking to others about, you know, what we do and what programs like us do, and kind of just telling people that might not be familiar with the cancer crisis, saying, hey, there are these kids from middle of nowhere Kentucky that are so passionate about helping their state and about taking these steps. And honestly, I've found just simple conversations to be the best form of advocacy and the best form of support. But also, we've had advocacy opportunities through Action that have been super unique, that have helped our program and help learn other people or teach other people about our program. Like, I don't know if you're familiar with Cancer Action Day at the Capitol, but we were able to participate in that, and we were able to continue to speak to legislators about what our program does. And, you know, that's obviously very important, to continue to talk to lawmakers and people in power about supporting the youth as they take these efforts to better our state. And so I feel like there are a lot of small things that have the most value. To kind of sum that up, I feel like small conversations and just, you know, kind of instilling trust in others that we really care about this and we take the time to educate ourselves on all of it. So.
Well, I'll add something again. I think helping provide opportunities for students to get in front of people to talk, and empowering them to do so, you know, which again, in part is just helping create opportunities for them to get up and speak with people about this issue. I also think, I mean, these programs, I think, and you saw some of the data, they can be super powerful in terms of the trajectory of where students go. One of the things I didn't tell you, in terms of our high school students, we now have 3 high school students that have started in the high school program, went to undergrad, and then now those 3 students are going into medical school this coming fall. So these are very impactful programs. So helping create and sustain these kind of programs, I think, can be super life-changing for students, right? So, and these are not cheap programs to run. So partnerships with places, either if it's in the community or if it's with the universities, to help create or sustain these kinds of programs is really important. I'm sure all of you know, like right now is a very challenging time, and the way, you know, the federal government is funding programs. This program is funded by the federal government. So, you know, looking at sustainability, I've worked pretty significantly with different philanthropic units on campus to help us provide funding. And like now is the time more than ever that we need to do that. And partnering with industry, I would love to do that if there are opportunities to do so. And again, it's all of the money goes to the students to support them, but it takes a lot to run these kinds of programs. One thing we didn't tell you, the high school program, so students, both undergrads and high school students, are in this program for 2 years. The undergrads are on campus and do stuff kind of all the time. The high school students are living out in their communities, right? So we do things during the academic year where they come to campus once a month. But in the summer, they come to campus and live on campus for 5 weeks. So they've been here, well, not here, but at UK for 5 weeks. They're all moving out tomorrow, unfortunately. But we pay for all of that. And you can imagine that's a very expensive thing to do. But I do think it's transformational for the students to participate in that kind of program. So partnerships, I think, would be phenomenal to help us sustain this kind of impact.
Ladies, you are a special group, and I just want to call out, I'm proud to have fellow Kentuckians working on this. This is your softball question, because you need one, right? I am interested in what each of you want to do when you grow up. What are you going to do with this? Medical school is an obvious outcome, but there are so many other options too. I'm curious if you are exploring those other options.
Yeah. So I don't think action is leading me to more medical school, but I definitely want to go into the healthcare field. And I'm thinking about nursing because I'm in the vocational nursing school for my high school, or becoming a nurse practitioner.
I really want to be a pediatric nurse, and Action actually helped me like figure this out because the Dance Blue Clinic is pediatric oncology and hematology, and that really just set it on my mind that I want to do pediatrics.
I want to be a trauma doctor, and with Action, I've gotten to do different clinical observations and kind of go through the list and check off what I was interested in and also what I wasn't. And so I guess that just kind of has helped narrow it down.
So I'm the oldest one here, and Dr. Vanderford and I were actually just talking yesterday. I think I want to go to medical school, and then sometimes I think I want to go to pharmacy school, and so I need to decide like probably now, but I know I'll get there. Kind of what they were explaining, Action has solidified that I want to work in oncology, and I know that I want to probably. Lately, I've kind of been thinking pediatric oncology would be something super special to go into because I am a committee member for Dance Blue that fundraises for the clinic all year and for pediatric cancer research. And so that's been something really special that I've gotten to witness, and Action has kind of given me like a holistic view of oncology, but seeing that specific part has been a really special thing to see. So I don't know, TBD. Hopefully this time next year I'll be able to give you all an answer.
Yeah, it's been surprising to me actually that so many have gone to med school. My hope is that, I mean, certainly we need people in all different types of career paths. I mean, and not even necessarily in medicine. We need policy people, which we have a couple students now that are interested in going to law school, which I think is great. And they're very interested in public policy, public health, and particularly here in Kentucky, you know, about how policy can help drive good health policy and help us make good change. But we're certainly open and want to help facilitate students going into any type of career path they want to go into. So it'll be exciting to have some go into nursing or other fields, which we desperately need, right, for this problem.
And even just like being involved in Action is so cool with the kinds of people that you can tell about it, because my older sister, she's actually going to Brandeis in the fall, U of L's law school, so pretty cool. But I get to talk to her a lot about how important cancer legislation is to me. And, you know, when she's going to be in these people's ears, I'm like, don't forget, say something about this. And, so it is just super cool to continue talking about action to people in all kinds of fields. So.
Other questions?
Hello, I'm Hogan, and I go to Morehead State. I'm a rising senior. And one of my shadowing experiences, I shadowed a pediatric oncologist. And one of the problems were that families weren't able to make appointments because of transportation. And so I was just wondering if you guys had any insights into how to get these families to be able to have healthcare access.
That's a great point to bring up, because that is something that we talk about often, because obviously, in our communities, we're at least like maybe 2 hours from the nearest medical center and the nearest cancer treatment centers. And, that's a huge problem. And transportation obviously is an even bigger issue because, we live in communities that are impoverished. And I would say that it's an issue that I could you give a little more insight on that? Because it's an issue that definitely needs a lot more attention, but I know that there are some programs that, they can bring it to you, as Dr. Vanderford was talking about, they can bring the treatments closer to you and do all these things, but that is definitely something that we all kind of inquire about often and hope to find a solution for, because it is very, very discouraging, and especially in our state where everything is just so, if you're not in Louisville or Lexington, then you're kind of just out of luck when it comes to those things, as sad as it is.
Yeah, I have something to say about that, but do y'all want to say anything first?
I knew you'd have
Yeah.
something.
It's a massive problem. So I mentioned my mom, this outreach clinic. That wasn't necessarily for treatment. That was just for like follow-up visits, right? So where she's from, where I'm from, it's 2 hours to Nashville. And, it's so hard, even for people like her. I mean, she has a car, she can drive, but how can you drive yourself to cancer treatments, right? When you are getting these really harsh treatments, you feel really bad, so you need somebody else to help you. But like my sister has a job, she has a kid, so it's tough. So I think there needs to be more treatment areas in these rural areas. But then of course there's financial economic issues there, right? So how do we do that? I think it's something that the state, the government needs to help step up and help provide. I mean, these communities can't totally self-support these really complicated, sophisticated treatments for these types of cancers, but we need that because patients just can't get access when they're like Morehead is a good hour from Lexington, right? So it's not huge, but it's insurmountable if you don't have a way there, right? So.
And I think that like wanting to be a practitioner in some sort of oncology field, it's obvious that wherever I work primarily will probably have to be like Louisville or Lexington, but I don't know how feasible it is and how exactly it'll look, but I do have hopes to, kind of bring the care to my people at home and kind of just navigate what that looks like. And even though that will be a complicated process, I think it all just comes back to, getting practitioners from where we're from that want to go and actually hands-on help the people from their communities. So
I'll follow up with that answer while we get that question. So
I just wanted to say, one solution is to hire and make sure you have oncology social workers on your team. So they can help with so many barriers to care, and transportation's a big one. But the oncology social workers are the ones that know the resources in that community. So every cancer program, every hospital should have lots of OSWs on their team.
right, I 100% agree with that, and I agree that those are hugely impactful. But in these rural communities, you have people that don't want to leave. So they don't want to burden other people, especially a stranger, to have them, even if that's their job. Like if it's their job to transport patients, they just don't want to burden other people. That's the mindset of rural people. So I think that certainly helps a ton of people. But I think to really address the problem, we need more places that patients in these communities can be treated very close to home so that they don't have to travel huge distances. I was going to piggyback on your answer. So what else do y'all hope for? Like, what do you want to see in your communities that can help address the problem?
Does anyone else want to start? Okay. I don't want to hog the mic. I just want to see, to begin with, I want to see more people that are comfortable speaking about cancer and comfortable, telling the older generation and telling their peers, like, this is preventable. Like, we can go to do these screenings, we can do these things, we can take more steps to better our health. And I think that obviously these problems won't be fixed in a day, unfortunately, but there are so many small things that we can continue to advocate for, that we can continue to talk about. And whether it's just as simple as like going on a walk with your grandma. Like, I always try to go on a walk with my grandparents when I'm home because, just as simple as things to promote health and to have these conversations about, we can take these steps ourselves. Like, obviously, there are huge problems that need to be fixed, but as long as we're doing what we can in our communities, I feel like that is so, so vital. And it's something that all of us can do, even if we don't know anything about cancer. So.
I think in my community, I just really want to see more support for those who unfortunately do get diagnosed with cancer, because a lot of people they do feel bad, but there's not a lot of support, and I think that would really benefit the families that are going through this and maybe even motivate them to be more serious about it and take more steps to prevent it.
So with social work, actually, I got to observe a social worker a few weeks ago, and she was talking about two sides of her patients, and some of them, they would take all the help that they could get, and then others, they just didn't want to ask for help. And so I think really just kind of letting our communities know it's okay to ask for help, and that's what we want to do. And so just kind of letting it seem like it's not a burden or anything.
I agree with everyone's answer, and I really think we just need to be able to sit down and have these conversations with our loved ones and people in our community and be able to support them through anything they're going through.
I'm pretty chatty. I like to talk, and so if you
haven't noticed,
but I think that I say that so often. It really is the most effective tool to use, to just talk to people and to just be a friendly face that they can trust you and they know that you're not going to lead them astray and that you really do care, and that's why you're here and that's why you're telling them these things. So, yeah.
Any final questions? Any final thoughts, comments?
Just thank you so much for giving us the opportunity to be here and tell you guys about this program that we love, because seriously, I don't know how I would have made it at college without Action and without Dr. Vanderford and Holly. I wish she was here so you guys could see her too, but just thank you for this opportunity, truly. And I love Twisted Pink, and I was so thrilled when I found out that we got to be here today. So.
Thank you guys so much.
Thank you.
Thank you.
So just to close, thanks again to Twisted Pink for the opportunity to be here. Holly, you've heard mentioned, Holly's the program coordinator for the program. She was unable to be here today. Courtney Martin is our assistant program coordinator. Lauren Hudson Rose is a person, she's a third-year medical student now that I've worked with a lot that has supported the program. We're funded by the National Cancer Institute. The Markey Cancer Center helps us out into tremendous different areas. Many of our students, especially our undergraduate students, do a lot with our Appalachian Center, which is great because they learn academically a lot about Appalachia, and there's service opportunities through that center also. And the Office of Undergrad Research we do a lot with also. And we have almost all of our high school students here with us today, the current Action High School students. That's us and all of us in a photo a couple weeks ago. So we're going to be here the majority of the day, so we look forward to more conversations throughout the day. So thank you very much.